How did epidemiology develop in European history? Imagine a time when people believed diseases were caused by bad air or divine punishment. It might sound strange today, but that was the early way Europeans thought about health. Over centuries, their ideas shifted from supernatural explanations to scientific ones. This change was driven by social, cultural, and medical progress. During the Middle Ages, repeated outbreaks of the plague led towns to try quarantine and sanitation. They didn't fully understand how diseases spread, but they saw that isolating sick people helped. Then came a big leap in thinking with Girolamo Fracastoro in the mid-1500s. He suggested that diseases spread through tiny particles he called seeds of contagion. Even though microscopes weren't invented yet, his ideas hinted at germs. Later, Antoni van Leeuwenhoek built better microscopes in the 1600s, which allowed scientists to see microorganisms. This discovery made it clearer that tiny living things could cause illness. As the 1600s and 1700s rolled on, Europeans started collecting data about death and disease. John Graunt analyzed birth and death records in 1603, creating the first statistical approach to understanding health trends. Bernardino Ramazzini studied work-related illnesses in the early 1700s, founding what we now call occupational epidemiology. In 1747, James Lind ran a controlled experiment on sailors with scurvy, showing that citrus fruits could prevent the disease. This was one of the first clinical trials. In the late 1700s and 1800s, doctors like Pierre Louis used numbers and data to study diseases more systematically. William Farr created vital statistics and kept detailed records of deaths, helping track disease patterns. One of the most famous moments in epidemiology came in 1850 for when John Snow investigated a cholera outbreak in London. He mapped cases and traced the source to contaminated water, proving that dirty water caused the disease. His work was a turning point, showing how data and fieldwork could control epidemics. Over time, European societies improved sanitation, introduced vaccines, and developed better medical care. These efforts helped reduce many deadly diseases. The growth of epidemiology was a mix of observation, experimentation, and social change. It went from simple ideas about bad air to a science that uses statistics, biology, and social understanding. Today's public health relies on these early efforts to prevent and control diseases. So, the story of epidemiology in Europe is a story of curiosity, innovation, and the desire to understand what makes us sick and how to stay well.